Hello, Namaste again. Introduction to Research Process. This is the first in the series of 19 video recordings for basic course in health research. So self-learning module 1. In this module, we're going to talk about the steps in research process. How do we start and how do we perform? So I have no conflict of interest with the content of this talk. There are various types of health research: basic science research or preclinical research, or we also call it PAHS research, clinical research, translational research. Many of you may not have heard of that. Epidemiological research, public health research, educational research, and many more. Most of the time, as faculty of medical school, we'll be doing either basic science research, clinical research, and in between, there is something called translational research. Translational research is nothing but a bridge between bench research to the bedside research, also known as bench to the bedside concept. So we generate something in the lab, whether it's in the in vitro lab or in the animal lab. Once we find something, then we want to implement it into the human system. And that's called bench to the bedside translational research. On the other hand, we practice something, find something in clinical trials, and we want to implement it in the community level, population level. That's called, again, translational research for the betterment of society, betterment of the public and the population health. Similarly, there is a big scope on public health world. It can be epidemiological research or different types of implementation, analytical research in public health. Similarly, there are also, as health, science, educational institution, we also have opportunity for educational research of variety of types, as we can see on this diagram. So how do we start? We want to do research, but where do we start? How do we start? That's a question. We want to be a scientist. So there are various steps. There's a process while we are doing research. First, we have to identify the most important thing, come up with a correct and right and something that is important as well as new, novel idea, also known as research question. So we start with idea generation or hypothesis. You don't have to be a rocket scientist for that. There could be just day-to-day question, which is not supported by literature yet. So we want to do literature search to see if that has already been done or somebody has already done or pursued similar kind of question. And even if somebody has done it, is it valid in our setting or not? So those are the questions. And you can always go and ask your senior or mentor or the expert in that particular field, the subject expert, to see if that research question is valid or not, or has it already been researched but not available in the current. Sometimes what happens is current literature doesn't show it, but it might have already been done and proven back in 60s or 70s when we didn't even have Medline or PubMed. So the next, we go to the design of the study, objectives, what type of study, is it feasible or not? And then we develop research timeline, develop protocol for conducting the research, data collection tool development, IRB submission and approval, all important steps before implementation of the research. Once we do all of that, then we come up with the implementation, or we proceed with the implementation of the research protocol. So it could be interventional research, or it could just be the data collection, passive data collection research. And we enter this into the at this time in AIDS, we should be entering this directly into the computerized database to decrease the amount of errors we may make while transferring it from a paper copy into the database. Data analysis, statistical analysis can be done, but this should be planned before collecting the data, because we want to make sure that we're asking the right question and collecting the data in the right manner. And then finally, the purpose of research is to communicate, to show or share the rest of the group in your department, rest of the faculty, and the healthcare workers in your institution, or even share with rest of the country or the world to show that what you have found, is it valid or not? And then see if actually applies to other settings or not. So communication is an important part of the sharing result as a final stage of the research process. So how do we come up with the research question? The research question or idea generation or hypothesis is not something that is very hard to find. This could be something that you might be doing in day-to-day practice, maybe during rounds, maybe during teaching, maybe during reading something. Then you come up with, oh, does this apply to my setting? Does this work this way or that way? So maybe you can come up with your own hypothesis or some idea that you want to find. So you go back and do the background literature search. In the lit search, you may find the answer. Maybe it's already been done, so you don't have to worry about it. Or you may not find the answer, or you may not find the satisfactory answer. The other way to find research question is to attend scientific meeting or professional society meeting within your country, within your institution, within your area of expertise, or maybe these days it's easy to find, the scientific sessions, recorded sessions online. And you can come up with different ideas in your area of or your specialty, and you can see if those questions are valid or not, if so, what else others have done, whether you can do something more in terms of research related to that particular question or hypothesis. And you can always go back and talk to your colleagues, your mentor, or the expert in that area. So what is clinical research? Just to understand the concept, because most of us will be doing clinical research or are doing clinical research. Clinical research is health research, which is basically the goal is to produce knowledge. Research means producing knowledge, finding new knowledge, or growing the current knowledge. And what sort of knowledge? It could be for understanding human disease, the disease process, either physiology or a pathological process, preventing and treating illness, and promoting health. So these are the basic goals of clinical research. So clinical research embraces a continuum of studies involving patients, diagnostic clinical materials and data, or even populations. There are various categories of clinical research as I have listed here. These are only some of the clinical research examples. Disease mechanisms, natural history of disease, could be translational research like we discussed earlier. It could be some kind of screening or diagnostic tests, behavioral research in psychiatry or even non-psychiatry specialties, health service research, epidemiology, community-based interventions, therapeutic interventions like clinical trials, or preventive or health promotional research activities. So when we are going to the next step after we have conceptualized what research we want to do, then we have to start planning or designing the study, which will consist of defining objectives, primary objectives, secondary objectives, specific objectives, aims, research aims, etc., that we'll learn later on. Study design, study feasibility. Is this study feasible at my institution or my institution plus other institutions, or it's not feasible because of certain barriers within the institution, certain barriers because of the cultural norm or beliefs, or certain barriers because of the finance or funding issues. Similarly, we have to come up with the research timeline. What is the practical research timeline to complete the study? Protocol development, how we can proceed with this research, the steps, and then data collection tool, what will be the proper data collection tool? And we always want to find out a valid or validated data collection tool. IRB training, because this is a requirement, the GCP training is a requirement for the IRCs and ERB within our country as well as other countries. This is very important, and it's available free of cost through different websites. IRB submission approval, which may take time. And if the research requires funding, then also we have to submit for funding. And also we have to figure out what would be the realistic timeline for a research. It takes about a month to a couple of months to write a protocol or the proposal for the research, because we have to do consultation, we have to do literature search, we have to send it to somebody who is expert in the field. So that takes some time. After proposal writing, we have to see who all needs to be involved and take their feedback also. Not only a research team, the research team doesn't mean just the investigator, but also many times, and nowadays more and more, patient involvement is encouraged, because the patients may have their own say. Maybe they want to be involved in one way, not the other way. So it's very important to take feedback or have the patients, potential patients or the similar type of patients on board during the preparation. Of course, that IRB training, submission, and IRB review takes some time. So all this will take about 3 to 6 months in most instances. The next phase after preparatory becomes the investigative phase, which is actually implementation of the interventions, if applicable. If there are no interventions, but still data collection needs to be performed. And there might be some lab works involved. And of course, while collecting data, we have to make sure that we are collecting the right amount of data and right type of data. So data management is also an important aspect of investigative phase. And depending on the type of research and the type of patients we are enrolling and the duration of follow-up, it may be somewhere from a few months to multiple number of years. So some of the big research with rare diseases, chronic diseases might last for a decade or even a couple of decades. But some of the research can be completed within a short few months. And then finally, the final stage is analysis and interpretation of data, abstract submission, presentation at scientific meeting, or submission to the publication. So step 3 is implementation, study training, related training, and team preparation, implementation of interventions, sample data collection and entry, data management, and study site monitoring. If there are multiple sites, we may have to go and monitor those sites. And also there is something called DSMB that we'll talk about later during the clinical trials. Data Safety Monitoring Board may be required to make sure that the data safety is ensured. The fourth step is data analysis, and it's always a good idea to have the statistician's viewpoint included even from the design of the study, so that we don't have any error in data collection or data analysis later on, because we have already met errors during the data collection or design of the study. Similarly, after the statistical analysis, the data have to be correctly interpreted, and we can come up with the inferences after interpretation of the data. Then, of course, as we discussed earlier, maybe we should submit in the abstract form and discuss in the poster form or presentation, brief presentation. At the scientific meeting, the idea is to get feedback from other experts or the researchers working in the same field. And similarly, we need to know how to make those presentations and give presentations at scientific meetings properly. And finally, if the data and the research is worth publishing, then it should be submitted for publication to a journal. So next we'll discuss briefly the types of research. There are quantitative research. Most of the time we're looking at the outcomes and measuring different types of measurements to see what kind of results we have. So most of the time we are doing quantitative research. On the other hand, there are also qualitative research, either because there's not much information, so we're just trying to generate some information or narrative descriptions of certain kind of phenomenon, or maybe we're just trying to conduct some kind of interviews to understand a particular process or particular entity in terms of open-ended questionnaires, interviews, focus groups, observations, etc. Similarly, patient satisfaction survey is also a type of the qualitative research. On the other hand, once we are into the clinical research, we have three major types of classification. So one is descriptive, the second one is exploratory, and the third one is experimental. So descriptive is description of characteristics of a group of individuals based on set of variables. So this can be done as qualitative research, case series, or survey questionnaires. On the other hand, exploratory is the examination of phenomenon and exploration of dimensions, including how it relates to other factors, or we're trying to explore an association between a disease and agent or a type of treatment and its outcome, etc. But when we are doing exploratory research with, let's say, a cross-sectional study or a case control study, all we're trying to do is make the association, to find the association between the cause and effect. We cannot establish cause and effect. In order to establish a cause and effect, we have to do an experimental study, which provides a basis for comparing two or more conditions for determining a cause and effect relationship. For example, RCT or randomized controlled trials are designed to establish a cause and effect. So the clinical research design could be observational or experimental. So observational design consists of descriptive studies such as case reports, case series, prevalence study, surveillance study, or analytical studies where we are looking at the association between two or more variables. And those are examples are cohort study, case control study, cross-sectional study. On the other hand, the experimental design are mostly we talk about randomized controlled trial, which is considered as the gold standard, or non-randomized controlled trial. So observational study only establishes, as I said earlier, association or correlation between two or more variables, whereas experimental study actually establishes cause and effect. In observational study, the researchers do not assign participants, they just do passive data collection. On the other hand, in clinical trials, we actually assign participants to one or more interventions and collect data. So analytical study could be a cohort study. If we start from exposure and follow them into the future, it's called prospective study. If we already have a cohort with certain kind of result and we want to look back, then it's called historical cohort and look at the outcome at present. So we're looking at the previous data, but we're already at the outcome. So the cohort study could be two different types. On the other hand, case control study, actually you start with the cases, and you divide case and control group, and then you look at the exposure. You actually are relying on the memory of what kind of exposure they had. Whereas in historical cohort study, you already know there is an exposure and you start with the exposed group. In case control study, actually, you're just relying on the memory and previous history, and you start with the end result. Similarly, case control study, you actually are looking at exposure and outcome at the same time. Just looking at the cross-sectional data, you may or may not catch what you're looking for. So cross-sectional study has its own deficiencies and shortages. So generally, when you're looking at the cause and effect, since cause and effect occur at the two different types, the association is stronger with case control study and cohort study. Cohort study has the highest ranking, followed by case control study, whereas cross-sectional study only gives you a cross-sectional association, but doesn't give you much information like in cohort study or case control study. So these are some of the observational projects. For example, the first one is we conducted this in Nepal a few years ago. Experience of treating COVID-19 with remdesivir and convalescent plasma in a resource-limited setting, a prospective observational study. So people who received either remdesivir or convalescent plasma or both were compared without any control over the intervention. So it was a prospective observational cohort. Similarly, if we look at the third one, this was use of intravenous immunoglobulin in severe Clostridium difficile associated diarrhea. So these were the patients who received intravenous immunoglobulin, and they were looked at to see what kind of outcome they had. So this was a retrospective cohort. On the other hand, comparison of posaconazole, itraconazole for treatment of histoplasmosis. These were the people who had already received treatment with one or the other antifungal agent, and their data were collected later on by one of the fellow in infectious diseases. So this was a retrospective case-controlled study. The experimental studies are the studies in which the participants are assigned to exposure and followed prospectively to compare outcomes in experimental group versus control groups. As I said earlier, it is divided into randomized controlled trial and non-randomized controlled trial, but there are also other types, such as small trials, and there are we'll talk about these trials later on when we're discussing clinical trials. So randomized control trials, or RCT, there is an intervention, and the investigator assigns the population or the interventional group into experimental group and control group. So the experimental group have interventions, and control groups have no interventions or standard of care. So RCTs are considered as gold standard, avoids selection bias, reduces confounders, and blinding further reduces information biases. However, the RCTs are expensive. Inclusion-exclusion criteria may be different from the real clinical world. And some of these RCTs may use certain drugs or interventions that could be unethical or harmful to the participants. So a good example of RCTs are the clinical trials for investigational and new drugs. And we know that there are phase 1, 2, 3, 4 in the clinical trials. In phase 1, the drugs are used in healthy volunteers to determine safety and also to determine what would be the tolerable doses in a healthy volunteer. So it's a small group of people, up to 100 volunteers are used. In phase 2, We're looking at the efficacy as well as side effect of the drug in a smaller group of people, meaning a few hundred participants. These are the people with certain kind of disease or condition who are likely to benefit from the intervention, and there is a control group also in this one. In phase 3, the efficacy and monitoring of adverse reaction in a larger population. So we're looking at the actual efficacy endpoints, and also we're looking at adverse reactions which may not have been picked up in phase 2. And generally, these are thousands of patients, and it may last, depending on the type of the condition and also the type of treatment, it may last a few years to several years. In phase 4, the drug is already approved for a certain kind of condition, and it has been marketed. So you want to see what happens if some of the side effects that are not seen in a few thousand people may occur when you are marketing in tens of thousands of people or hundreds of thousands of people. Maybe some of the people might develop certain kind of side effects, or there might be certain safety issues which are not picked up in a few thousand people. So a post-marketing surveillance for safety and efficacy is done during the post-marketing phase. So I've listed some of the examples of experimental projects that I had performed. So the first one is phase 2 RCT for safety, efficacy, and PK or pharmacokinetics of daptomycin, 6 milligram versus 8 milligrams. And the comparator arm was vancomycin or teicoplanin in the treatment of osteomyelitis with an infected prosthetic hip or knee joints by the MRSA infection or coagulase-negative staphylococcus infection. So here we see the different doses of daptomycin was being determined, and at the same time, we're also looking at the safety efficacy data as well as PK data. On the other hand, in phase 3, you usually establish the PK data. Sometimes you can also add PK data to this one. And in this one, we looked at linezolid and vancomycin in the treatment of catheter-related gram-positive bloodstream infection. It was a double-blind trial, and we found that linezolid is not as good as vancomycin for bloodstream infection, so the linezolid should not be used for bloodstream infection or endocarditis treatment. Another phase 3 trial, recovery trial done in Nepal for COVID-19. We looked at different types of drugs as well as high dose and lower dose of corticosteroids for treatment of COVID-19. Similarly, another open level phase 3 trial was done in Nepal under WHO, known as WHO Solidarity Trial Plus Trial. This is underway for publication soon. And we compared artesunate, infliximab, and imatinib for the COVID-19 patients. Similarly, I was involved, this was about 20 years ago, a SMART study, which is a landmark study that defined that antiretroviral treatment should be started on all patients at the time of diagnosis and not wait until their CD4 count goes to certain lower level. And it was also an open level randomized control trial. Another study, a phase 4 trial after marketing a drug called Maravrac, they wanted to see if it causes more side effects compared to the other drugs. So this is a level of evidence of pyramid because all we're doing is generating evidence to support our clinical practice. So on the base, you can see expert opinion or editorials. Usually that's also part of the expert opinion, but supported by some references. And above that is case series and case reports. And above that, case control studies, then cohort studies, randomized control trials or RCTs at the almost top of the pyramid. And of course, systematic reviews combine the various results from randomized control trials, cohort studies, case control studies, or even case report case series to come up with a composite result and recommendations. When we look at the quality of evidence rating for various different types of publications or recommendations or guidelines, we can see on top of the quality of evidence, the evidence from randomized control trial come up at the top, followed by non-randomized trials, followed by cohort or case control studies. Then any evidence from series, case series, or uncontrolled experiments, etc. And at the end, the lowest is the opinion from experts if there is no other evidence available. This is just an additional slide I've kept to decide what kind of clinical research you are doing. So the first question would be, did investigator assign exposures? If it's yes, then experimental study. If there is no assignment of exposure or intervention, it becomes observation study. So just passive data collection. On experimental study side, if it's randomized, it's a randomized control trial. If it's non-randomized, it could be non-randomized control trial or quasi-experimental study. Under the observation study, if the comparison group is only descriptive, it's descriptive study. If there is a comparison group, then it's called analytical study. And depending on which direction in time has the data been collected, if it's exposure followed up until outcome, it's called cohort study. Exposure followed up until outcome, but taken historically, studied historically would be historical cohort study. If it's outcome with case and control chosen at the present, and you're looking at the data retrospectively, then you're looking at the case control study. And if you're looking at both exposure and outcome at the same time, same point in time, then it's called cross-sectional study. So in summary, we discussed research designs and steps in conducting research. It's important to have a good planning and preparation for conducting a research study. And also the researcher need to choose correct research design and use valid methods to generate acceptable research results. So always get involved, get experienced researcher or seasoned researcher or a statistician involved right from the study design. And more details on these clinical research and their methodology will be discussed in other online presentations as well as during the workshop. These are the references, and you can see them on your slide set. And thank you for attention. This is the end of this first online course. Thank you. Bye-bye.